The Gabriola Clinic is a community-owned and physician-run clinic that has family doctors and nurse practitioners and a healthcare team of other professionals around us, including social worker, mental health nurse, and home and community care nursing staff. We have an amazing staff of people who help keep our days running and keep our patients happy. So our dynamic is one of professionalism and collaboration. We all share a space where we do our charting, and it allows for a lot of really constructive dialogue around our patient care and also really just support about our general lives. If someone has something interesting that they're not sure next steps, and certainly with our learners, we have residents and medical students at times, doors are open to make sure if interesting things happen, we're all sharing in that learning and that opportunity. The physicians that have been here for years are happy to support and mentor any new people coming in, answer questions, taking into account that people sometimes bring their best qualities and best skills to the clinic, but they might not bring experience. We're hoping to find a physician to join us that's interested in doing primary care and having an excellent background in general practice type of family medicine. The beauty of rural medicine is that you get to try your hand at anything you're interested in because it all presents itself to our doors. We're also interested in having someone join us that loves the outdoors, that wants to live in a beautiful island community where, you can be home and in your kayak in 10 minutes after the end of your workday. We're looking for people who are fun and who really enjoy living and working in a place where they can be their full selves. Whether you're an introvert or an extrovert, there's space within the clinic to work quietly, and there's space within the clinic to always be present with other folks. I think that someone coming into this practice has such a beautiful opportunity to really realize the full scope of their training and of their expertise. Whatever they would like to do and what they're able to do, they can work on that as part of the practice. So if there's people and they want to do more geriatrics, or they're interested in addictions medicine, or they're interested in home visits or other types of work, there's room for us to try to figure out how to make this the perfect practice for them. In this community, the emerging needs that we're finding is an increasing number of issues with mental health and drug use, and so there's certainly lots of space for us to be working with that patient population more specifically. And then our population is always aging, so geriatrics and how to care for people with complex medical conditions. Luckily, we've gotten lots of support from our island health partners. We have access to the Rural Locum program. Those rural locums come in and they're already comfortable working in a rural setting, and it allows us to take much needed time off. The community has had access to specialists over the years. Right now we are working with an internal medicine specialist, we have a psychiatrist, and we have a lot of access to a geriatric psychiatrist through telehealth, and there's just a lot of collaborative work happening. Our community is filled with all kinds of things to support people at different ages and stages of their life. So we have a fantastic early childhood program through the Hope Center for families that are coming with younger kids. There's childcare available in the community, and we have a fantastic elementary school with all kinds of great programs, including outdoor play, community gardening, music programs. It's a really wonderful place for kids. And we also have really great things for older folks, so if someone's coming at a different stage of their life, there's a ton of volunteer activities. We're also an amazing community of artists, so if someone has a creative inclination either as a maker themselves or someone who appreciates art, there's lots of opportunity. It's a really great community for feeling vibrant in that sense. And then of course our nature. So we're surrounded by the sea, we're surrounded by forest, we're surrounded by trails, we're surrounded by opportunity in that way. So if you mountain bike, if you kayak, if you walk, if you bird watch, all of those things are absolutely here every day, and year round there's beautiful opportunities for being part of the nature and also being part of our community. Employment in the community for physicians partners can really take on a whole bunch of different looks. We have good internet access and good services there's a lot of people in Gabriola who have what used to be urban-based positions that are now doing those from their homes here. There are a number of charitable organizations that are always looking for people with amazing skills and contractors to do work for them, grant writers or any kind of administrational work. But then there's also nature-based and outdoor-based opportunities for people as well. The other benefit is that there's a really great ferry service to Nanaimo. So a lot of people who move here to do a specific type of job, their partners will work and commute to Nanaimo. You can get off the island about every half hour from early morning until late evening. We can get to Vancouver in 15 minutes on a float plane that leaves very regularly from our island, and then the ferry service to the Lower Mainland as well. I came to Gabriola straight out of my residency training. I was looking for a place to kind of get my feet wet, figure out what kind of doctor I wanted to be, figure out what kind of community I wanted to live in, and I didn't really have the intention of being here in the long term. What kept me here was the beautiful people that I work with every day. So I had great mentoring, I had great support, I had great colleagues, and that's continued to be true. The things that I love to do, kayaking, fishing, raising my kids in a place where they can run barefoot and wild, those things have mattered a lot to me. I think when you come to a place that fits, and if you can find that magic, then you don't leave.